And welcome to the Dr. Bob Show. How much do you worry about your shoulder? Do you know that it can cause problems at any age group? Why is that? What's the architecture of the shoulder that makes it so susceptible to injury at any age? We'll be talking about that on this show. My guest is Dr. Paul Brady. Dr. Brady is a board-certified orthopedic surgeon and deals with the shoulder every single day. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. And later on, we'll be talking about the importance of exercise and your shoulder, about eating properly and your shoulder, about getting 7.5 sleep and rest for the muscles that surround your shoulder. And most of all, it's that laughter in your life. If you get out and socialize and move around, you'll be moving your shoulder around, and we want to keep that shoulder healthy. A lot of information for you. We're talking with Dr. Paul Brady, board-certified orthopedic surgeon, and we're going to be talking about the shoulder in all age groups, because we still got a shoulder when we're old fogies, and we got a shoulder when we come for childbirth. Paul, welcome to the Dr. Bob Show.
Thank you so much for having me. I'm glad to be here.
It's an honor having you on my show at any time. Tell me about the shoulder's structure. What makes up a shoulder joint?
So the shoulder is actually probably the most complicated joint in the entire body. The reason being because we have to have such a huge amount of motion in the shoulder to do what we need to do. 270-degree arc of motion. That blows away any other joint in the body. So it takes a lot of structures working together to make that work efficiently and safely, and for us to have the best use of the shoulder that we can have.
Is it easy to understand, or is it difficult? Because at all ages, different problems occur.
The basics are pretty easy, but the complexity, that's when it gets difficult, and that's why you really need to see a shoulder specialist if you have a shoulder problem, because it is kind of complicated when you get into it.
Unequivocal.
Yeah.
So what does the shoulder joint look like? I remember the word ball and socket.
That's right.
So what does that mean?
So there's several ball and socket joints. The shoulder is a large ball and a shallow socket. I think of it like a golf ball on a tee turned on its side. So the only way you can hold that golf ball on a tee on its side is all these other structures, muscles and ligaments and tendons and everything working together to get you a good shoulder.
Are there an unreasonable number of ligaments and muscles that protect the shoulder?
There's a huge number, and that's probably 3/4 of my training is to learn the appropriate anatomy, to learn the right mechanics, and now I can help patients to get back to that situation if they're in trouble.
I can remember dropping by with United Way, your office, and you're showing me the physical exam and the range of motion and what you look for when you put the arm through different techniques, and I was amazed.
There's a lot.
Absolutely amazed about the information that was in Paul Brady's head. So it's got a lot of muscles. Are there any muscles from the back, the shoulder?
There certainly are. Yeah, the shoulder is held on by two things: the shoulder blade, or what we call the scapula, and then the collarbone. And so those two are the struts, if you could use that term, to hold the arm and the shoulder in place. And then the muscles surround that to make everything work.
Where's the collarbone?
The collarbone is this front bone. It's also called the clavicle.
Well, yeah.
And a lot of people have injuries to the clavicle, from trauma or sometimes it's more of a chronic situation where they get some arthritis on either side of the clavicle, and those things hurt.
The muscles, tendons come off of the clavicle?
Yes.
To hook onto the chest cage?
Exactly right. They come from the clavicle, they come from the scapula or that shoulder blade. That's where all the rotator cuff muscles start, is on the shoulder blade. And then they surround the ball and they allow a person to move that shoulder in every which direction.
How does somebody know? It's a simple question for you and me. How do they know they need help?
The most common symptom that I hear is arm pain. You would think it would be shoulder pain. It's actually not. It's more arm pain. Sometimes it's in the shoulder and sometimes it's up into the neck as well, but arm pain is super common. The second thing that I hear all the time is it hurts at night.
Yeah.
When it hurts at night and you can't sleep on it,
you
really need to see somebody, because we need our sleep. You'd mentioned that. That's one of the big four. You got to get your sleep, and if you have a bad shoulder, it's going to be hard to get your 8 hours of sleep for sure.
So that pain comes on at nighttime, and it's arm pain that's referred from the shoulder joint. And a lot of times people are trying to sleep and all sorts of contortions at nighttime. So if I got a stiff shoulder, I think I need to go see a primary care doctor. I think they need to see the orthopedic surgeon, because he's going to know what's going on.
I wouldn't hesitate to go right to the specialist. The primary care doctors, though, I will say, do usually a wonderful job at a good workup of the shoulder, because it's such a common problem. So it's something they see all the time as well. It's a really common problem.
What's a routine workup for a shoulder? X-ray?
That's right.
Different angles?
So we get several X-rays, and X-rays look at bones. But there's a lot more than bones to it, right? So then we do the physical exam. And from that, I can tell a lot. You can tell kind of where they're weak, where their shoulder's not functioning properly. And based upon that, we may or may not have to go. The next step is to get an MRI, because the MRI is really the gold standard for looking inside the shoulder.
Better than a regular X-ray?
Yes, it looks at all the soft tissues, whereas X-rays only look at bones.
Better than a CAT scan?
CAT scans are pretty good too, and sometimes we have to get a CAT scan. Let's say you have a pacemaker. Can't do an MRI with the pacemaker. So a CAT scan is not bad, but it's not nearly as good as an MRI scan.
And the MRI just walks through the shoulder, the muscles,
That's exactly
the connective tissue,
It
the
actually takes
tendons.
little slices of the shoulder, pictures of the shoulder in different slices, and from that, the computer amazingly puts all that together into a picture that we can read and understand.
So what was it like to you as a shoulder orthopedic surgeon when you saw your first MRI and saw what it was like?
I thought there is no way I would ever be able to learn how to read this, right?
Yeah.
Because it's a lot. It's 180 or so images, and it's a little daunting when you're in training to learn how to read this. And slowly but surely, when you know the anatomy, then you can translate that into the MRI, and now it's the easiest thing in the world to look at an MRI for me.
Yeah, it's just like, boom, that's part of my family here, the shoulder.
Yeah, that's right.
Anything that the MRI doesn't show you?
It doesn't show some of the pathology. It doesn't show as well. Let's say arthritis. X-rays are actually much better for showing arthritis than an MRI scan. Sometimes it distorts the anatomy a little bit, and so we got to be careful with that. And when we're reading it, we always take it with a little grain of salt. But in general, the MRI is pretty remarkable.
When you look at an MRI of my shoulder, you look for muscles that have gotten weak. You look for tendons that are torn.
Yes.
You look for soft tissue can you see if the soft tissue, the space that the shoulder occupies.
We can.
Can you
the main thing we look at on MRI, or one of the main things, is what we call edema or fluid. If fluid or edema is in a place that it ought not be, that's probably a problem. And so that kind of clues us into, okay, here I see some fluid. Why is there fluid there? And then from there, we can just do that natural detective work to figure out what's wrong with the shoulder.
It's a natural evolution of figuring out why am I waking up in the middle of the night with pain in my shoulder.
Exactly.
Most common shoulder injury that you see?
Rotator cuff tears by far.
And that's what we're going to be talking about. Rotator cuff tears. We're talking with Dr. Paul Brady, board certified orthopedic surgeon. We're talking about the shoulder. More activity comes from the shoulder than probably any other joint in the body, and it therefore can cause lots and even more problems. So what are the problems, and what's the most common problem? Well, it's a rotator cuff injury. Now remember, the shoulder is supported by a group of muscles that surround that joint, and if anything happens to those muscles or those tendons or that space in there, we got problems. We've said that when the shoulder is bothering somebody, they have nocturnal pain. That means in the middle of the night, my arm's killing me. Doc, it's not my shoulder. It's, So did you x-ray this part?
Yes, right.
And so the patient really knows where the pain is, but it actually is up in the shoulder. Is that pretty much
That's
correct?
very accurate, yes.
Okay, so let's talk about what can happen to those muscles and tendons and space.
So I separate tears into two categories. You have what we call acute tears, and more commonly, chronic tears. Acute means you had an injury, whether it's fall or a dog pulls you on the leash or pickleball. Gosh, pickleball, that's starting to cause some shoulder problems. Or more commonly, it's a chronic problem. That means it's kind of slowly coming over time. Patients don't know exactly when they started having shoulder pain, but they started having shoulder pain. The chronic ones are usually due to the tissues changing characters and then starting to develop little tears that add up to one another and eventually start to give you symptoms.
So the acute injury, the sudden injury, the violent injury, will take one of those tendons and cut it right in two?
That's exactly what it does. It usually pulls the tendon off of the bone, but it's a clean injury. It's a clean cut injury. The repair is a pretty simple repair. Typically, we just pull that thing right back where it belongs and we secure it there with some amazing technology that I've been very fortunate to be involved with the development of.
Didn't you write a book on
Yes,
arthroscopy?
we wrote some books, and I've got about 7 patents on some of these products that we use to repair the rotator cuff. And we use these anchors. They're called anchors. They go into the bone and then they tie the tendon back down to the bone. So it's a great way to fix the shoulder.
So to me, I'm thinking about the viewing audience, and when we anchor something, it may be a screw that you sterilize and get it clean.
That's right.
That is sitting there based in that shoulder, and we can do magic things around
That's
it.
exactly. They're actually made out of tricalcium phosphate, so they're made out of calcium. So the screws are made out of calcium. There's no metal. They're made out of calcium. We put them in the bone, and then sutures come out of the screws, and we use those to tie everything back down. And it's a really slick, nice repair that's very, very strong.
Make an incision where?
So we do this all arthroscopically. That means we don't have to make any large incisions. They're just little teeny incisions, less than a quarter of an inch usually. No stitches, just 4 or 5 of those little teeny incisions, and we go and we build the ship in the bottle, basically. We use cameras. Cool. It's very, very, very exciting.
Yeah.
The technology's amazing, and it's changed so much in my career. I've been here 18 years, and the technology is totally different now than what it was when I started.
It's like night and day.
Night and day.
The
It's
difference
amazing.
in quality of the care that we can give the patients.
We can do
there.
so much more for patients now.
So if it's chronic and there are multiple tears in the muscles that go to the tendons that secure the joint, the shoulder joint, how is that more difficult?
So because the tissue is a little bit more difficult to deal with in the chronic tears. You know, it's not as good a tissue, and it's not as healthy a tissue. Now, thankfully, with the technology, again, we still have some amazing ways to augment that or to repair that and still get a very good result. But the chronic ones are a little bit more difficult to deal with than the traumatic injuries.
So a chronic injury that's been there, that's been fading away into the sunset,
Right.
how do you nourish it, make it where it gets more viable, and what can you do with technology to make it where it's a nice bouncy tendon or joint?
Well, so during surgery, we spend some time assessing the situation, you know, seeing what kind of tissue we're dealing with, and then we do what's called mobilization. So I kind of release different areas of the tissue where there might be scar tissue or there might be what we call adhesions. That's a bit fancy medical term for scar tissue, essentially. And I release those.
How do you release those?
So I have some instruments that I use to release those, whether it's electrocautery, which is kind of electrical energy, versus shaver, which is kind of a razor blade inside of a tube. And then I once that we do that and get to healthy tissue, then we can get a good repair. So we kind of have to get rid of the
bad
unhealthy
and
tissue
bring
and get
on the
down
new.
to healthy tissue to get a good repair.
Can you see, feel, get x-rays showing when you get to the healthy tissue?
You can, primarily through our camera and looking and feeling. You know, you kind of nailed it. We take instruments and we feel it, and then we use the visual cues to see, okay, does that look like healthy tissue? That looks pretty healthy tissue. It's bleeding. It's got good, good pliability, and it bounces well. And so then we're ready for the repair at that point.
I can remember showing a football recruit several years ago, and the doctor went and put his finger under a tendon and lifted it up, and this athlete went boom, because it was an unusual experience for him.
Sure.
But those advances, and I've seen this so many times before, makes your decision easier?
It does. It gives me more options to offer patients, and that's the important thing. You know, before we didn't have as many options for patients, and that's a difficult situation when you kind of tell a patient, I don't have much to offer you. But we have so much better technology now, so many more things to offer patients to get them a healthy shoulder.
What's made the biggest difference in the last 2 years, or 3 years, or 5 years?
I would, one of the biggest advances in shoulder surgery has been something called the reverse replacement prosthesis. It's a replacement surgery. You know, it's a different surgery than what I've been talking about, but it's been one of the biggest advances in all of shoulder surgery for sure.
So you take out the shoulder joint, the sort of cup.
That's right.
And then you make a cup out of the bone that goes there.
You've got it. We
then you bring 'em
reverse the mechanics, the normal mechanics, we reverse it. It started in Europe, and first time I saw it, I thought it was crazy. and I thought, no way this will work. But I tell you what, the people who thought of this, they really thought of an amazing thing, and it's offered a lot of patients relief from pain and ability to get their function back.
So what seems to be the biggest change, improvement of the shoulder when you do a reverse replacement? What can the patient do?
Well, pain relief, number one, but one of the biggest is the ability to have overhead motion once again.
Such as combing and throwing?
Combing and throwing, exactly, and many other things.
And that's what we're going to be talking about when we come back. How much and how important is the overhead function of the shoulder allowing us to perform and go to the Olympics? You'll want to stay tuned. I'm overwhelmed with the amount of information that we can find in the shoulder. Now we're talking about what's the importance of return of function with somebody that has reverse replacement. We decide that that would be
Overhead function is very, very important.
like what?
You know, I mean, you think about it, and so much of our life is accomplished over shoulder level. And patients who can't reach above shoulder level are usually frustrated. They can't reach for a coffee cup. They can't do their hair very well. You know, simple things. And of course, more athletic things like serving a tennis ball or pickleball in this case. You know, you got to serve underhanded. But, you know, hitting an overhead in pickleball. Those are things that patients really want to be able to do. And a reverse usually allows them to get back to that.
So I think that's phenomenal. And they can get back to being throwing overhead actively.
Yeah, absolutely. Now, you know, you're not going to throw the football 70 yards. I can pretty much promise you that. But most patients can get back to very good overhead function.
What does the patient say to you, the physician, when they can suddenly throw a ball 10 yards and put a little zip on it, maybe?
It's pretty life-changing for some patients when they've gone a long time without being able to really reach overhead, and particularly when they have a lot of pain. You know, when we can get somebody out of pain is probably the most gratifying thing we can do as physicians in general.
Keep them out of pain. Do we use physical therapy?
So activity, we'll mention it again because it is so important. Therapy is important, activity is important, and just staying healthy and keeping moving is so important for the health of your shoulder.
So you got to keep the engine running. You got to fuel the engine with food, sleep, laughter, and the things that we always talk about in the Dr. Bob Show.
Absolutely.
So where I stand right now is that you have taught us there's a lot of injuries. There's a lot of things that we can do. There's a lot of new technologies. And with that, if we use all that, we should be able to enjoy our shoulder.
Should be, yeah.
I want everybody to remember the 4 things that we talk about every show. Number 1 is exercise. So you got to exercise your shoulder.
You got to do it.
If you let it just sit there and not do anything, it's going to freeze on you. It's going to get where it won't move.
That's right.
It's going to need help again from the orthopedic surgeon. Yeah. Well, we've got to have proper nutrition. And so there's certain kind of foods that we would want to eat, like more protein or more carbohydrates, or just a normal good diet.
Protein's very good, you know, lower carbs, lower sugars, decrease inflammation. Sugars are terrible for increasing inflammation, and we know that.
And they taste so good sometimes.
Oh my gosh, they're addictive, you know. I mean, I'm the worst culprit, but nonetheless, that is so important to try to decrease sugars. And you know, you'd mentioned eating. I mean, it's kind of hard to eat without the shoulder, you know, because you can't get that hand up to the mouth without your shoulder. And so really the shoulder is even involved in that portion of
So maybe
our
we
health.
could come up with a painful shoulder diet.
Yeah, that's right.
You know, don't let us bring the food
We could.
up
We
there.
could.
Sleep. We can't sleep if our shoulder's hurting.
It's the number one thing that brings patients to me is not being able to sleep at night. So
That's amazing to
when
me.
you can't sleep at night, you really need to seek help, you know. And if it's your shoulder or your arm pain that's keeping you from sleeping at night, please go see your primary care doctor, see me, see a shoulder specialist, but get seen and get helped.
I would anticipate seeing just predominantly shoulders, that you get to be more knowledgeable, or you have the opportunity of becoming more knowledgeable than somebody that's doing neck changes or hand problems or wrist problems or other problems.
I think that's true, yeah. I think that's true in, you know, pretty much any field, but for sure shoulders, they're so complex and they're so intricate that I think it really helps. It's all I do, you know. I mean, shoulder is all I do. I don't really take care of much anything else in the body other than shoulders. You know, I haven't yet. So far so good.
What a great thing.
Yeah, it's great.
We're going to see this. Every patient is new. Every patient has a new problem.
Yep.
And everybody has to be treated differently. So you have to understand the shoulder. You have to understand the pain. You have to understand where everything's coming from.
Absolutely.
And then with that, we can come out with a good plan.
Agreed.
So Paul, Brady, you're a great teacher.
Thank you.
Remember, you got to be exercising. That includes your shoulder and your whole body. If the whole body is being exercised, you will do a whole lot better. Start the day off with 7.5 hours of sleep. Well, how am I going to do that? Pretty easy. You go to bed and you count 7.5 hours ahead of that, and that's when you set the alarm. And so you get 7.5. Some people may need 8 hours, but there's a lot of controversy about it. If we sleep too much, it can actually be bad for us. Inflammation can occur in the body if we stay asleep too much. And most of all, what is it that we like on the Dr. Bob Show? It's that laughter in your life. So find somebody that you enjoy playing tennis with, that you giggle with, that you enjoy being out with socially. And as you are more adept at being happy and be excited with your life, and always remember that it takes the mind in order to get the body happy. So remember, exercise, nutrition, sleep, and most of all, what is it we like on the Dr. Bob Show? It's that laughter in your life. If you laugh a lot, you'll stay healthy, you'll stay happy, and you will enjoy yourself.